thank you everyone for joining us today. We're really pleased to have Professor Vitor Filgueiras from Brazil to talk about lessons learned from Brazil around addressing labor exploitation and slavery. Our event today is organized by HCRI, and we worked in collaboration with the Work and Equalities Institute at the University of Manchester. So our speaker today, I'm very pleased to have him today, like we've met a couple of times already. So Dr. Filgueiras is the founder and project coordinator of a really interesting and innovative project called Caminhos do Trabalho, Path to Work, and another project, Vida Pós-Resgate, Life After Rescue, working more specifically on modern slavery at this end. And so these are two programs led by done at Fundacentro, which is part of the Ministry of Labor in Brazil. And Dr. Filgueiras, on top of this huge project coordination on these two projects, is a professor of economics at the Federal University of Bahia. Vitor is an economist by training and social scientist with a global academic expertise. And he also has professional, like more hands-on experience in bridging policy, practice, and academia. He also held visiting positions at various institutions like Complutense University of Madrid and University of California, Irvine. He served as a senior scholar at the Federal University of Bahia, where he's coordinating the project along with Fundacentro. In the past, he's also been a labor inspector for Brazil's Ministry of Labor, and that's what grounded his interest in his experience as a labor inspector in Brazil, grounded his interest in addressing exploitation and poor working conditions. So without further ado, I'm going to let Professor Filgueiras start the talk. So we'll have roughly half an hour-ish of talk, and then we'll have a good time at the end to ask questions, especially because I'm hoping this event will be about us, mostly based in the UK, learning about the experience of Brazil, who's been quite at the forefront of labor rights and fighting exploitation and slavery in that case. So Vitor, I'll let you speak now. Thank you. Oh, sorry, I just forgot to mention, you have a Q&A section where you can ask questions throughout as well, so I can pick them up at the end. So feel free to also just use the Q&A section for questions. Sorry, Vitor, it's all for you now.
Thanks, Saba. Hello, everyone. It's a great honor to be here with you. Hopefully, internet is going to work well. Please, if there is any kind of oscillation in the connection, you know, if my voice is not going well, just tell me. Otherwise, I'll keep talking here, you know. As someone that has some experience talking, I can like engage talking and maybe lose time. But I will focus here. It's a very hard task, honestly, here, because I'm going to present very briefly two programs that are huge, not in terms of, I would say, the scope, you know, they might be at some point, but there is a long story behind them, you know, behind both projects. And I'm going to try to like summarize it here. That's why also I'm going to use the some PowerPoints to ensure that you can follow, you know what I'm saying, even if you have some trouble with the internet, and also because I think that some pictures are nice to illustrate what's going on here. So once again, thank you, Saba, very much for the invitation. I'm very honored to be here. I hope it's like one more step to something bigger, wider, and more profound that we can build together. And let's go and be like straightforward. So there are two programs in Brazil that we started as pilots almost 10 years ago in the Federal University of Bahia that pretty much seek to address the limits of exploitation, of labor exploitation. If you think like in a conceptual way, that's the the main targets of both programs, but in different directions. One of them tries to tackle slave-like conditions, tries to organize and give the opportunity for workers that were rescued in slave-like conditions to have a sustainable alternative to carry on with their lives. We're going to talk a little bit about this program in the end. It's called Vida Pós Resgate, or Life After Slavery, Life After Rescue, in a literal translation. And the other one, that's the one that we are going to start with, is called Caminhos do Trabalho. The translation, I think it would be maybe Paths of the Work, not literally paths to work, but paths of the work. So to say that we can have different paths or different outputs, for workers, especially those who were injured during work or because of work, both accidents at workplace and illness or disease related to work. So, as I said, I'm going to use some PowerPoints just to also keep me on track. Otherwise, I can talk a lot, as I said before. Let's use it here. Is it working? I can't see you. Is it working,
Yeah.
Saba? I
Yes,
can
it
see you
works.
now perfectly.
And could
So-
you go full screen, Vitor?
Sorry.
Could you go full screen on the PowerPoint?
Yeah, just a second. As usual. I can find it.
If
The
you
full
can
screen here.
go, sorry, if you can go at the bottom, bottom right, you have like the minus plus. The button, the first square next
Just
to
a
the
second.
minus.
I just
is the
got
one.
lost here. Come again.
At the bottom, right?
Yeah. This one here?
Yes, this one.
Yeah, I knew it, but there we go.
Thank you.
When you need it, your mind doesn't work well. Anyway, as Saba has already said, we are talking about two different programs that are being coordinated by the Ministry of Labor, specifically Fundacentro. Fundacentro is a public foundation, which I'm working right now. I'm a professor at the Federal University of Bahia. Both projects, Caminhos do Trabalho and Vida Pós Resgate, were designed and the pilots were started in the Federal University of Bahia. Actually, as a labor inspector, I used to think about these issues. I used to work literally with these issues, and the ideas and the demands and the problems and the ideas to try to tackle the problems that come up from these issues, I started to think and I started to develop these ideas when I was a labor inspector. Then, as a professor at the Federal University of Bahia, I had the time that I hadn't as a labor inspector to think, to create, and to work to develop these two programs. As I said, firstly, as pilots, and now, since 2023, actually, we're gonna complete 3 years now at Fundacentro. I was appointed to be a project coordinator at Fundacentro, and I have been able not only to have time to make these programs national programs, but also we were able to build, a team with more people, and most importantly, we could design and implement a design that's built the foundation of the design of these programs is a multi-institutional. They are multi-institutional programs, both of them, with different institutions, but in the roots of both programs, you have different public institutions with different scopes, with different prerogatives, with different possibilities that come together, coordinated by Fundacentro, to implement caminhos do trabalho and vida após resgate. That's something very important, and that's something that I think make it easier not only to implement this kind of programs, but also to make it last. Otherwise, you put all your effort, all your energy, and all your hope in one institution, and maybe things change, and all the effort, all the energy is wasted because you can't make it last. And there are other aspects that I hope I will have time to talk about also regarding this multi-institutional, interinstitutional approach that both programs have. Like I said, conceptually, they have something in common that's, by definition, trying to tackle or to impose actual limits to labor exploitation. When we're talking about accidents at workplace, we're talking about lives of people. So if there is no limit to labor exploitation regarding health and safety, the person will die. And people do die every day, all the time, all over the world, because of labor, because of work, actually. So the life of a person is a limit. It's a limit, strictly saying, literally a limit to exploitation, in the terms that if you go beyond the limits and corporations do it frequently, the person will die and you cannot exploit the person anymore. The second limit, just to make it clear, vida após resgate tries to impose, caminhos do trabalho tries to impose limits in the way that people will not get hurt, or at least will have some rights that will try to make corporations think twice before hurting them or harming them during the work process or the labor process. Vida após resgate, on the other hand, is dealing with another limits of labor exploitation, which is legal limits that if the corporations go beyond these limits of exploitation, the state does not recognize that relation as a wage labor relation, as something acceptable. We're not talking about labor rights only, because if a corporation does not comply with labor rights, the labor relation, the wage labor relation will keep going. Maybe there will be a fine, maybe you can consider this a violation, but slave-like condition is when something is beyond the limits of labor exploitation in a way that even the capitalist states will say, look, that's too much. That's beyond the limits of exploitation. You're not going to accept this. So in Brazil, we have a task force, very traditional task force for over 30 years that has tackled and rescued people from this kind of exploitation beyond the limits. And vida após resgate comes to complete, the scope of public regulation to address specifically the these people's lives afterwards, after the rescue. So they are rescued, so what else is going to happen? What's going to happen next? So I'm going to start with caminhos do trabalho and give a very brief overview, just you to have a taste. As I said, I'm really keen to engage in further conversations and so on. But just to give a taste to you, Caminhos do Trabalho is built nowadays in a kind of network between many institutions, specifically saying 18 different public universities, federal universities across Brazil, in all 5 regions of Brazil. We have a local team, some kind of units in each of these universities. Also, as I said, Fundacentro is the main coordinator of the project, Caminhos do Trabalho. We have the labor inspectors from the Ministry of Labor as well, the Public Minister of Labor, and the public company, the public corporation that runs all public hospitals in Brazil, linked to universities. not all public hospitals in general, but all of them that are linked to universities. So that's our framework. What's the main goal, the main task, the main what's like the core issue for Caminhos do Trabalho is to tackle underreporting of occupational accidents and illness. It's not that the project does just that. That's like the roots. Above everything else comes. And by tackling underreporting of accidents and illness at workplace or related to work, either if inside, the workplace or outside the workplace, but related to work, by doing this, we are helping to promote public planning. It's a huge issue. If you don't know where the accident is, what's going on, in which corporation people are getting diseases or are being harmed physically or mentally. Of course, it's pretty much impossible to plan and to carry out any kind of effective public regulation regarding labor. Also, we seek to promote institutional cooperation. Like I said, the very framework of Caminhos do Trabalho is based on institutional cooperation. And in Brazil, our public institutions normally, and especially regarding labor issues, they normally don't work together. There are frictions between them, some tensions, and loads of time is wasted. Also, they become more ineffective because of this lack of cooperation. So Caminhos do Trabalho is seeks and honestly is helping a lot to engage and help other institutions to come together and work together to promote labor rights, especially regarding health and safety. Also, and one of our main goals is to enforce labor rights, protecting workers that had the suspicious that were injured in the workplace. They come to the project. Let's try to make it very simple in our minds. How the project works. Coming from different sources like workers' unions, public institutions, internet, whatever, workers come and approach the project with complaints regarding, normally, almost 100% of the time actually, they complain that they were hurt at the company, they got some disease, they suffered some kind of accidents or some kind of illness, no matter it's physical or mentally, and because the corporation did not recognize, did not admit that they were hurt at the company, there are very different outputs, bad outputs regarding labor law especially, but not only. I'm going to talk a little bit about this. So they come and we have a team all over Brazil, with students, undergrad students, PhD students, medical doctors, psychologists, like nowadays we have over 20 different areas to help bringing all of these areas together to give assistance to these workers. So they come, we interview them. So what's our demands? What's going on? We have a juridical assistance regarding different aspects of labor rights. The person will be assisted by a medical doctor and other health professionals, such as psychologists, physiotherapists, and so on, to analyze if what the worker is bringing to us makes sense. We have literally an investigation using different sources, different methods, including anamnesis, like a physical analysis of the working condition, to see if there is a causal relation between the disease, between the illness and work. Let's say that's our rice and beans, that's our daily basis way of approaching and helping people, is to see if there is a causal relation, technically saying, and to try to enforce the rights related to this situation, if it's related to work. Also, as I'm going to talk a little bit later, there is a huge public financial issue regarding these accidents, because the tax paid by companies varies a lot depending on how many accidents are admitted or registered, reported in one specific company and in some sector. Also, something very important in this process, and that's also the roots of our framework, is to investigate, in an academic point of view, sectors, disease, corporations, and many different aspects of health and safety and work health and safety. And by doing this, and to do this and to carry out this task, of course, we are preparing, new professionals to deal with health and safety in a different way, All over the world, there is a huge hegemony of the individual perspective regarding health and safety. That's terrible. I can't talk about it now, maybe at some point, but it's terrible because it's like the worker has the responsibilities and has the tools to prevent accidents or to keep himself or herself healthy in the workplace. And it's an absurd, because of course it doesn't depend on his will or her will. The person does not control the labor process, does not have the tools. The person is subordinated to the corporation. So I'm not even talking about the collective approach regarding the epidemiological picture itself, but regarding labor relations, the very labor relations, it's something that the individual approach by itself is not even wrong, but it directs any kind of discussion to something very not only harmful for the workers, but something that will reproduce the accidents and keep the accidents going and keep the harming conditions forever. Anyway, of course, public policies are needed to protect injured workers, and we have different public policies in Brazil that, of course, I wouldn't be able to talk right now. But to be very, very straightforward, when someone gets injured in the workplace or because of work, the person will face difficulties, of course, that can vary. For example, if the person cannot work, maybe if there is no public policy to assist them, the person can have problems with income. Also, if you have no public policy to enforce, for example, social security, how is this person and what's going to happen with them? And if you don't have any kind of strategy to enforce or to identify the situations, by definition, all other aspects or targets or goals from public policy will not be reached, because it's not happening. So the underreporting of accidents or illness at workplace, it's on the basis of any kind of public policy regarding health and safety to try to give assistance or to improve working conditions or help workers that were harmed. Otherwise, if you don't report, if you don't identify the situation, it's pretty much impossible to do anything about it. Like I said, the report is a worldwide issue that affects workers, affects planning, of course, affect the public budgets. And sometimes people don't think about it, but it affects fair competition as well. Corporations that comply with labor law and try to keep their workers safe or health, spend more money than those who do not comply with any kind of law. Just to give you a taste, once again, and try to be faster here. In Brazil, pretty much 85%, 85, it's even more nowadays. It's almost, or probably only 90% of workplace accidents are not reported. So we have just a tiny idea about how many people are injured because of work in Brazil every year. For workers, the main issue, there are different ones regarding labor rights, is that if the accident is reported, you get job stability of 1 year. Just make it simple. It's a little more complex, but that's the point. And that's one of the main reasons that companies try to avoid reporting, because they want to use the worker, exploit them, and when his or her is injured, just throw out them, just dismiss, and socialize the costs. I have talked about the planning and the tax issues. Just to give you an idea, you can the tax regarding accidents at the workplace may vary even 12 times, the amount that corporations are supposed to pay. So the payroll can be taxed from 0.5% up to 6%, depending on how many accidents are reported. The latest data talks about 17.8 billion that were paid, but 94% of the corporations in Brazil pay their tax rates at a reduction tax, because clearly, and it's like something very, very clear and not controversial, they underreport and they pay like maybe half, maybe even worse, maybe even less than half of what they would be legally supposed to pay. Just to give you another taste here about the Brazilian picture, there was a very interesting public policy that was being enforced here that would identify the relation between accidents, illness in the workplace through a statistical approach in the social security institution, our social security institution. It relates sectors and disease and different disease. And when there is a statistic significance between some sectors and some disease, it would automatically be identified, classified as a work-related accident. It would be a great public policy. It is, in theory, but our social security institution is not enforcing it. It has dropped over the years, the percentage of enforcement. And actually, one of the goals, like the meta ideas of Caminho do Trabalho, is to help to change the situation, trying to work together with the social security institution to see if they, like, I wouldn't say come back to the situation before, but to improve, the enforcement of this statistical procedure, because what it does, it changes the assumption of the relation between disease, illness, and work. Instead of the worker has to prove individually that there is a relation between the disease and the work, now the corporation has to prove, because the assumption would be if you have someone working in a call center and this person has a shoulder problem, the assumption is that there is a relation there. The company would have to prove otherwise. Also, just to give you a taste, among 100 millions of other examples that I could show you, the call centers here, I'm showing some like anecdotal data here. They normally have thousands of people, thousands of workers with illness related to, not necessarily, but some kind of illness or disease that makes them need to stay out of work over 15 years. So we're talking about like hard stuff. And there is a clear mismatch between mental illness, especially when you compare, for example, to the labor market as a whole, and people that suffer mental illness in these companies. And just to give you a taste here, I'm not going to read, of course, none of the main corporations, none of them, it's not like one or two, admits that a single person, for example, this one had 443 people that had mental illness that had to stay out of work over 15 days. In none of these 443, the corporation admitted that it was linked to the work. So that's the kind of situation. It's very, very symptomatic, you know, it's very clear. It's not something controversial. So just to pass, I know that I'm talking a lot to the other program, trying to summarize here, paths for work or paths to work, however we translate it, caminhos do trabalho. Tries in its being able to bring institutions together, you know, the Public Ministry of Labor, the Labor Inspection, the universities, try to link university to reality. That's something very important. Try to make universities, in fact, not only teach people in classes, but also to improve their learning, you know, acting in real issues, you know, and knowing, like technically saying as well, and learning about health issues in a very practical way, and using this learning to improve academic investigations and also to have a better formation as a whole, you know, to be better professionals. As I said, on a daily basis, what we do in Caminhos do Trabalho is to report, you know, we do the reports, we have this power of accidents and illness that the companies would not admit that are related to work. By doing this, we are able to provide or to ensure that workers will get their social security benefits that normally they don't get it. And also the output of these individual cases, that's how we work, like try to be more clear here. We help workers to get their rights enforced, but by doing this, we collect data from many different workers at the same corporations, and we make like reports to help source labor inspection, the judge, the labor courts, and the Public Ministry of Labor, in a way that we are acting individually, on an individual basis, and on a collective basis, try to solve or at least to improve the working conditions in each case. This was just one example of a labor court case that we took an iFoods courier. He was shot during work, and we were able to get him to receive his rights, both in the social security benefits and his wages. That, as you know, all over the world, these companies call themselves platforms, which doesn't make any sense. They are companies as any other, and they say that they pay rates, what is also an absurd. They pay wages, but that's another topic here. But anyway, we were able to enforce and to guarantee that this person would get medical treatments and his social security benefits and his wages. To end this first one, and I promise that I'm going to be faster now for the second program. We are in Caminhos do Trabalho, we are changing our scope now in terms of amount of people that we attend, amount of workers. We have now up to today assisted some thousands of workers, something like 5,000, something like that, since they start in the Federal University of Bahia, since the beginning. And our idea wasn't to be like a huge program, but with this MOU that we were able to sign with the public corporation that runs the university hospitals, we have the possibility, I don't know if you're going to be able to reach up to 20 million people. And we can talk about this later, because that's the amount, the number of people that these hospitals receive, attend, and help every year. And that's our, let's see, our meta wider perspective right here. So just to try to summarize here and go to the other program, when you talk about underreporting of accidents related to work, it needs to be more expensive for employers, not to report into reports. There is a financial incentive that's very important. Also, stakeholders other than the employer must be able to report. I know that it happens in the UK. I don't know if it has changed, but when I was there, it was this way. And also, state institutions need to coordinate report accidents. Otherwise, each one will be talking to itself, and it's not going to work well. The second program is called Life After Slavery, or Life After Rescue. Vida após resgate in Portuguese. The idea of this program is, like I said in the beginning, to give the opportunity for rescued workers in slave-like conditions to have a different life. In Brazil, like I said also, there is this task force made of, that brings together labor inspectors, public minister of labor, the federal police, and other stakeholders to seek, investigate, and rescue workers in slave-like conditions. And it's been 30 years that it's going on. And this task force goes to places, farms, whatever, building sites, and they literally catch people being submitted to slave-like conditions, extreme forms of exploitation, and they take people out of the situation. That's why they say that the person is rescued. And they do this based on the criminal codes here. There's an article that states what slave-like condition is in Brazil. And among, the most common situations like forced labor, threats, and so on, there is a concept of degrading situations. When someone is in a very, 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 for example, this picture that you are seeing right there is someone like working literally on top of chicken feces, So it's a human degrading situation. It's also classified as slave-like conditions, and these task forces rescued people that are submitted to this kind of conditions. We're talking about, during the last 32 years, we're talking about over 60,000 people were rescued in slave-like conditions here in Brazil, in pretty much every state, in pretty much every economic sector, small cities, big cities, rural areas, cities, and so on. The thing is, there are many indicators that most of these people are victims of slave-like conditions again. So the person is rescued, the person gets his or her wages, unemployment benefits, other rights, but by definition, it's a temporary situation. You get your wages and everything that your employer owns you. It's gonna last for some months, and then what's gonna happen? For example, there is a survey that was carried out by the ILO that found out that almost 60% of the workers that were rescued in that survey had been submitted to slave-like conditions prior. So rescuing them is something very important, but what else? What else is going to happen? How are they going to carry on with their lives? So what Vida Pós-Resgate does is something very simple. The program approaches workers and offers the possibilities for them, especially in rural areas, rural workers, to organize co-ops, with no wage labor. That's like the basis of the program. They will work together democratically to produce healthy food. So the idea is to take the workers out of the labor markets. Conceptually, that's the point. Instead of training, I'm going to train you and I'm going to go back to the labor market to see what happens. The idea is the completely opposite. We're going to give you the tools, the lands, the facilities, the equipments, everything, and training for yourself to work to yourself among your colleagues, in a democratic organization, to produce healthy foods. In this way, you skip the main source of labor exploitation, which is the asymmetry between employers and employees. That's the main feature of any labor markets around the world. So the idea is to make the person, the people, the workers, have an alternative way of living, producing in a professional way. It's not something precarious, improvised. No, it's very professional. I'm going to just show you some pictures for you to have a taste. To get like money, enough income to have a decent life, a good life. In a good life, in the place in which the person comes from. Our slave-like conditions different from the UK. In the UK, slave-like conditions are normally linked to migrants from other countries. In Brazil, it's internal migration, normally, almost 100% of the time. I'd say 95%. But we're talking about internal migration. People from different states, they go temporarily from Bahia to São Paulo, from Rio Grande do Sul to Santa Catarina to find some kind of opportunity. And normally they fall in traps, and they are vulnerable and exploited up to slave-like conditions. The program states and gives the opportunities for them to say, look, do you want to work together with your colleagues in some kind of co-op in your place of origin, so you don't have to travel, you don't have to submit yourself to a vulnerable situation, you can live a good life in your place. And that's what the program promotes. From the idea, the organization of the associations up to the selling of the products. In every step, we have people, we have staff, we have a team to help the workers to organize and to develop these activities, which they choose. They choose what's going to be done. And it's also sustainable. So it's socially sustainable because it's something structured, doesn't rely on the labor market, doesn't rely on the economic dynamics, and doesn't rely on the will of employers, but also it's environmental sustainable because we focus on agroecological production for all the reasons, for the health, the workers' health, for the community health, and for the health of people that will consume these products, especially children, because one of the goals of Vida Pós-Resgate is to sell the products to the institutional markets, especially for meals, for public schools, for children. Just to give you some ideas, this one.
just want to
Sorry,
tell you, yeah, just
I'm finishing.
if, yeah, cool, because we'll take
I
10
know.
minutes if you have 3 minutes.
I'm sorry. Just to give you a taste of what kind of things are being provided and are being done. This is a farm that is producing cocoa. Normally, we help them to integrate the production between vegetable and proteins to be sustainable regarding the use of water, regarding the use of energy sources. I have talked about the school meals, just to give you an idea of how things begin here and how things are going different places. Today, nowadays, 15 different units are producing foods, different stuff, from beans, cassava, corn, sweet potato. The plantations are irrigated. Eggs, agroecological eggs. That's an example of a solar power installation. Ships. Maybe at some points we can talk about this. We have a way of integrating some materials, raw materials that would be considered trash, and we are able to use it, and they can be used in a very potential, way regarding feeding the animals or being useful for the cultivation of different seeds and so on, fruits. That's a tank for fish, that's when the chicken farm was being built and how it's going right now. There are coffee farms as well. Anyway, just to give you, like I tried to say, a taste regarding how Vida Após Resgate is going today. And I talked a lot, I know. I hope you have some time to exchange some ideas, but anyway, I'm available to do it or another initiative like that again at any time. Thank you.
Great. Thank you so much for sharing about these programs that are very unique to Brazil as well. And I think it highlights how, like, the difference in terms of right protection and support for workers between UK and Brazil as well. I think you have a stronger system that you can offer through your project and through these connection between university and real life social actions, I would say. I just want to, so I've seen there's already, if anybody has question and want to raise their hand, we have 2 questions in the Q&A. So one from Hossein Said, who is asking, how do you measure labor exploitation and modern slavery? So maybe I let you answer that. And the other one, I don't know, do you see the Q&A maybe?
No.
Okay, and this, do you want the 2 questions or one after the other?
It's up to you. I can do.
Okay. Okay.
Should
So
I
maybe
answer this one? No, that's up to
go
you.
for it. Go answer this one on how you measure.
So the question is how
exploitation
I
and modern
measure or how the Brazilian state measures?
I don't know. Hossein, if you're online, you can unmute.
Hi, so if you
Right.
measure this by yourself, what is your measurement there? Or if it is measured by the Brazilian government or like Department of Statistics or something. So do you know their measurement criteria for that? Thank you.
For the project, right?
Yeah.
Yeah, great question, really. This is a very important question for the second program, Vida Após Resgate. Why? Because the way that people are assisted, are approached, the start of the program is the identification of slave-like conditions. So it's a situation of extreme exploitation defined by the labor inspection. That's the answer. So labor inspectors go to farms, to building sites. They make physical inspections, go to the sites, talk to workers, see documents, see the environment, see the working conditions and everything. And there is an article, as I said, 149 from the penal codes here that states what slave-like conditions are. As I said, this article talks about, defines it in a broadly way, saying that as usual, as the ILO convention states, forced labor and so on, like direct in individual coercion are slave-like conditions, but also the article states that exhaustive journey, working hours, and especially degrading working conditions are define the crime in the situation as a slave-like condition. So the most extreme form of exploitation. Then you are going to ask me, so, but how is it defined? Up to some years ago, it would be a general description to define it. You know, it would be rules like clearly you have to have like no water, no foods, and so on. It wasn't written. So the labor inspector, like I used to do, you'd see the role situation and write a report to define if it's a slave-like condition or not. It was, let's say, more subjective, but it wasn't, because the situations were very clear, you know, very degrading. It wasn't something like there wasn't any controversy. But because of employers' pressure, the Ministry of Labor issued a normative, internal normative, you know, a guideline to say you have to look at these indicators. Like I said, there is no water, there is no place to sleep. People were like being fed with poisoned foods, or they were hungry, they were starving, to define it. So that's how it's defined right now. To caminhos do trabalho, it's not an important question because we assist any kind of illness, disease, no matter if it's something that's very harsh or not. We are going to look for the workers' rights, see if there is a causal relation between the disease, the illness, the accidents, and work, and try to provide and to enforce the workers' rights.
Right. Yeah, thank you so much for that. The second question is from Anna Virmentera. Anna, do you want to ask your question or do you want me to read it? You can unmute if you want to speak.
Oh, hi.
Cool.
Thank you. I can ask it. So, Vitor, I'm also Brazilian, so my question is regarding the dirty list, a lista suja of employers. So Brazil has this dirty list of employers who are caught by doing unsustainable practice, like slave-like conditions. And I was wondering how reliable it is if you work with that list, if you use that list to find the companies and to find the workers who need help, and also do you follow it at all or not?
You mean if I follow or if people follow?
I specifically both. You can answer both, yeah.
It's a very reliable list. You can trust it a lot. It's a very serious list, but it's not exhaustive. You know, it's a tiny sample of the problem. But like what I mean, if the corporation is in the list, for sure, workers were submitted to slave-like conditions. But it doesn't mean that a lot of other corporations, actually, like many times more corporations are submitting workers here to slave-like conditions. But in the sense that the quality of what's written there, yeah, it's very reliable. And it's a good question if people follow it. There are some institutional approaches to this dirty list. For example, some financial corporations make it difficult, you know, to lend money for corporations that are in the dirty list. Public banks do not lend money for corporations that are in these lists. So in that sense, people not only follow, but there are like material consequences for being in the list. But on a wider perspective, like it's public, you know. Sometimes some corporations have issues regarding, for example, financial bonds and so on. They lose money. I would say that it's a very important public policy, and it's not a coincidence that employers have tried to undermine the dirty list for 30 years, for, I don't know, 20 something years. It's from 2003, 2004. Anyway, it's a very important document, and it has to be strengthened.
Thank you.
Thank you for your questions. Anybody has a burning question? I think we were also, if you do, please just raise your hand. And Vitor, we were asked as well if you can share your slides, if that's okay.
Sure.
Yeah, and we can share your contact as well to people who registered for the event. So if you do have any follow-up questions, you can also ask Vitor. I don't see any hands. And for Sahid Hussein, also I'm an idiot. My work is to define labor exploitation and modern slavery for research. So if you want, I can also share my conceptual frameworks, and that's how I met Vitor. There is lots of overlap between my more theoretical work and the practical work that they're doing with these two programs in Brazil, which is genuinely great. And I think, yeah, just 1 hour doesn't do justice to all the work you're all doing in Brazil. So thank you all very much. Vitor, if you want to say a last word, and then I'll close.
Sure. Thanks so much. Once again, I'm available to further talks, chats, you know, clarifications. Hopefully I was understandable, mostly at least. And as I said, it was a pleasure and an honor to be here.
Yeah, and we're really glad we had you and heard more about Brazil. I think we need to import a bit more of the labor system from the UK, in the UK, sorry. So thank you so much, everyone. I will share with you the slides and the contact of Vitor as well for any follow-up. And I can also send a link to my paper, Defining Exploitation, as well for your answer, Sahid. So thank you so much, everyone, and have a great rest of the week. Bye.
Bye-bye.
Bye. Thank you so much again.